My name is Nathaniel Otoo. I come from Ghana. Until February this year, I was the CEO of the National Health Insurance Authority of Ghana. Currently, I'm an independent consultant. I do recall in 2012, we were invited to Morocco as a country team to discuss universal health coverage. And the theme was really on equity in UHC. I had the responsibility of forming the team, and I put together a team of 4 made up of people from the health sector provision, service provision, sector, a parliamentarian, a financier, and also a policymaker. And during this conference, there was one issue that really resonated with us. How do we measure equity in UHC, considering that Ghana had embarked on a massive transformation of its health financing system or healthcare financing system with the introduction of a national health insurance scheme. Now, we did a country presentation, and in this country presentation, we put together our strategy, proposed strategy for mainstreaming equity in the national health insurance scheme. Soon after we went back to Ghana, at the time there was an ongoing process to change the health insurance law. And what was really exciting and interesting was that we were able to make an input into the passage of the law, which was almost at its end within 24 hours after we went back to Ghana. And equity provisions, made it into the main law. And currently, it's a requirement that equity be reported on an annual basis. I actually got into health by accident, but not by design. I was, before health, I was in social security. Obviously, it's part of social protection. And when the health insurance scheme started, I was asked to help, put in place structures for the health insurance authority. So I started really in administration and legal, and subsequently my interests in health systems got excited. So I transitioned into the operational aspects of health insurance, and subsequently, after 10 years of service, I got to be the CEO. One policy reform I was involved in was a complete review of the National Health Insurance Scheme, which started in 2015. The purpose was to make recommendations to government on how the NHIS could be made more sustainable, more, should I say, responsive to the need of the population, but also to make it transparent and accountable, as well as an institution that provided learning to the entire health sector. This process took a year, and in 2016 September, a report was submitted to the president. Subsequent to that, a new government came in office, and the new government has actually also taken it and sort of formed technical teams to look at the recommendations, and that is being completed as well. Nobody starts a process of review of innovation by thinking that they're going to share. A lot of the time, sharing comes as an afterthought. And what is most important, I think, is to actually make sharing of information and knowledge an integral part of knowledge development and innovation. So that being an afterthought, it's not an integral part that one can say, well, as I go along with improving knowledge, I document how I do it. That is one challenge that I see. The second challenge really is that contexts are different, and what we have to do is to actually, look at the context in which knowledge is developed and try, first of all, to generalize what has been done, and where the contexts are similar, to actually then be a bit more particular on the successes that have been achieved. There's lots of good examples of what works in many countries. A lot of the time, it's not systematically documented. Where it's been systematically documented, it's not being shared, and sometimes it's buried, in archives. The other thing is really what we forget is that, learning is from person to person. First of all, who does learning benefit? So who are the beneficiaries of the learning? The second thing are, who are the people who provide the learning? And the third is, who are the people who determine what learning should take place? We don't really emphasize the person-to-person nature of learning. And what I believe I'd like to see is, a reinforcement of these two aspects of learning. How do you make learning people-centered? And secondly, how do you make the process of looking at what works and what does not work an integral part of the development of learning?